Noon on the East Coast of the United States. Welcome to everyone from wherever you're joining. This is the Anesthesiology and Critical Care Professional Community Town Hall meeting. My name is Archer Martin, and on behalf of our chair, Ashley Fritz, and the rest of our leadership team, thank you for coming today. Our agenda is fairly straightforward. I'm going to go over the current and incoming professional community leader group, touch base a little bit on membership statistics, and give you a little perspective on where we've been and just how far we've come as a professional community. I'm going to talk a little bit about what we can do as a community to come together at Toronto for our upcoming meeting in ISHLT 2026, and also highlight some of the pre-conference workshops, which are definitely relevant to those of us who are anesthesiologists and critical care physicians. Some other aspects about opportunities for us to engage in the ISHLT, whether it's ongoing symposium proposals or standard and guidelines documents, as well as webinar ideas, and finally open it up for discussion and questions. This will be recorded and placed on YouTube, so if you're looking at this afterwards, thank you for joining us as well. Just looking here at the overall professional community group. Our chair is Ashley Fritz. She is an anesthesiologist at Mayo Clinic in Jacksonville, Florida. She had another event that she could not make it today, but she welcomes everyone. I serve as a member of the Leadership Advisory Forum, and I am going to be rotating off of that role. But I will be the chair of the membership committee starting next year, and I'll talk a little bit about that in the coming slides. Aline Gregosian is a critical care physician and emergency medicine physician who is out in California. She serves as our ECTC, or Early Career and Training Committee representative. Catherine Kozarek is our member representative to the Pulmonary Vascular Disease IDN. Devor Silva is our representative to ISHLT in Espanol. Dr. Verzaloni Sef is our representative to the Advanced Lung Failure and Transplant IDN. And then Dr. Vera von Dassau, she is our representative to the MCS IDN. So as you can see, and if this is your first exposure to ISHLT, particularly with regards to anesthesia and critical care, there's an opportunity that no matter what your interest is, there's an opportunity to connect with a community, to get engaged, and get involved with pushing forward the next best ideas in the clinical, educational, and research aspects of the patients that we all take care of every day. Now, looking a little bit about our membership statistics, the anesthesiology and critical care professional community has been growing year over year. And currently, we represent about 3% of the total population within the ISHLT membership. And I think that's a great number. We are the people who every day in the operating room will interact with colleagues from all of the other professional communities. And of course, our roles in the ICU, we continue to engage with pulmonologists, cardiologists, surgeons, allied health, and other colleagues as well. I think ISHLT is such a great society for us to join because the interdisciplinary care that we're allowed to provide a perspective for will only advance the care for our patients. And whether you focus more on heart or lung transplant, mechanical circulatory support, or pulmonary vascular disease, you'll be able to find your place here. Looking here at our demographics, you can see that we have a diverse demographic all over the world. So wherever you're joining from, there are going to be ISHLT members in your region or even specifically in your country. Membership type, you can see here that physicians predominate, but we have a growing non-physician membership as well. And so I think it's also an important point to make, particularly for those colleagues who are here in North America, that APPs are absolutely welcome as well in the anesthesiology and critical care space. And we have some that even have served in leadership positions in ISHLT. So I think it's a great way for us to work in a collaborative fashion. Now, focusing a little bit about our upcoming meeting in Toronto. One of the great things about ISHLT is that we bring people together, and we have a professional community reception scheduled for Friday, April 24th, 5:30 to 6:30 p.m. Eastern Standard Time. If you're not sure where it's going to be held, we'll be able to provide that information as it gets closer, and there's certainly the opportunity through the ISHLT app that will get closer to the conference to look at specific lectures or symposia that are going to be relevant to those in our professional community. I've had the opportunity to serve on the program planning committee, and there's certainly a whole host of lectures that are going to be helpful for all of us in advancing our knowledge and also contributing throughout the question and answer session and further networking. So it's going to be a really great time in Toronto. Now, the main meeting also is preceded by pre-conference workshops. Now, I've personally signed up for the Cardiogenic Shock Academy. I think it's going to be a great one. But you can see here, there's a whole host of selections. And there's going to be opportunities for us to further our learning, get more CME, and continue to network within in an interdisciplinary fashion so that we can gain colleagues and add perspectives as needed. One of the ways that we've been able to engage as well is through the propagation of educational services for ISHLT members and beyond. We've had professional community webinars. And as you can see here, the anesthesiology and critical care webinars hit quite a bit above our weight. You look at our registrant counts, but you can see that we have a big presence on YouTube. And this is because we put out great content. So I would say as you see ISHLT webinars come up, continue to promote them to your internal group, external group of friends on social media, and let's continue to maintain that momentum so that our voice is heard and that our perspectives are added to the overall care of our patients. It's a relatively brief PowerPoint, but I wanted to emphasize those important points. Over the last year, our professional community has had excellent engagement both within and outside of ISHLT. There's continued opportunities for those of you who may be interested to learn more about how to engage. I would encourage you to email any of us. You can email myself, Ashley Fritz, who's the PC chair, or anyone who's associated with the leadership group. Not only will we be happy to hear from you, we'd also be happy to see you in Toronto. So, with that, I'll go ahead and open up to any questions for anyone who's attending, or if there's any other aspects about our PC that want to be discussed at this town hall. Thank you. Juliet, one thing that I forgot to mention is that we do have some new PC leaders coming on and some rotating off. Do you have those names and those respective positions? We can go over them real quick.
Yes, I will place them in the chat. Yeah.
And I'd just be curious if anyone who's attending this webinar, is anyone here not an ISHLT member? If you don't feel comfortable, that's fine. But if you could raise your hand on the Zoom, and if you had any specific questions, we can talk about opportunities both in our PC and more broadly in the society.
Hi, Archie. This is Richa. I am a member, but I had a question for you. What kind of endeavors have we done in the past? I'm kind of new to this group. Can you just describe a little bit about the past year or last 2 years, some of the things that we've done?
Oh, hey, Richa, it's great to see you. I think there's been really two main areas because I want to focus on ISHLT, not just being a society that's around the annual meeting. Of course, the annual meeting is very important, but we're an annual society where there's opportunity to engage year round. Within the professional community, I think the webinars have been one of the big areas. We've held several webinars over the years, and as I noted before, had some really good attendance, especially relative to the percentage of our population within the overall membership. But then the second opportunity has been a growing representation in the offerings of the ISHLT, and those have really taken two forms. First, through the Standards and Guidelines Committee. So, the Standards and Guidelines Committee is where all of the consensus documents and other guidelines come through. And if you've taken a look at JHLT, you can see that we've put out some high quality ones as a society, and that the pace of them has continued to accelerate. Over the last few years, in particular, we've seen a growing representation by anesthesiology and critical care physicians and members of the professional community. So I think that's been a really, really important and key part of our overall output. We've had primary and senior authors on these papers, as well as co-authors, and really across an entire selection of those consensus statements. Second of all, we've had a growing representation within the annual meeting. So the annual meeting, the way that it's set up at ISHLT is that it's very professionally run and it has significant continuity of leadership. So it's a very well thought out and designed process where the program planning committee is chosen from all professional communities, all interdisciplinary networks, geographically, gender, and grade diverse. And one of the things that we've seen is continued increase in relevant symposia and workshops and abstract sessions related to anesthesiology and critical care. So I would say that the role of this PC, this community, has really been seen in those areas. And I think that that's part of the exciting part of being, in this society. I know for me that as an anesthesiologist, a lot of times I might say, well, I'm going to go to ASA, SCA, EACT-IC, and those are great societies. But I love transplant. And so coming to a transplant specific one where it's not just anesthesiologists and critical care physicians, but it's multiple specialties. You're welcome. You're able to collaborate with them. There's been many different projects that have come out of my association with ISHLT, and I think that that also applies to many other members of the PC. So I know that was a long answer. Does that kind of cover it for you?
Yeah, no, that sounds great. How do we get involved in those, depending on our interest? Like, if I'm interested, in writing and helping with some of the, your guideline papers, what can I do to get more involved in that? Or if I'm interested in being a part of the, the meetings and getting involved in either speaking or planning the meeting, how do I get involved in those things?
I mean, you're asking great questions. Thanks for asking those. So I would say, I'll take the meeting one first. One of the best ways is to show up and volunteer, and there are so many different volunteer opportunities. When I first came to ISHLT, one of the first things is that I did was volunteer to be an abstract reviewer. There are hundreds and hundreds of abstracts, abstract reviewers. There are thousands of abstracts that are put in. So there's plenty of opportunity to sort of engage and hit the ground running there. A lot of the communication that goes around volunteering opportunities, both in the society, specifically for the meeting, and also writing opportunities, comes through ISHLT Connect. And there's also quite a bit of communication that comes out on emails ahead of specific deadlines. So, in terms of the meeting, of course, come to Toronto. There's a lot of us that are going to be there. I actually just purchased my ticket in my hotel and I'm making plans and it's really going to be an exciting time. I'm going to be there, as I said, at the pre-conference day all the way through, so it's going to be great. But show up, and then the abstract reviewing request for volunteers usually comes out around early summer. Is that right, Juliet?
Yes, that's correct.
Yeah, and so that's going to be your sort of entryway into that pathway. And then, of course, at the meeting proper, network, come to the events, come with us, and we'll have a good time. Second, in terms of the overall writing process, there is also a call for volunteers for writing. There's actually one that was recently sent out. And sorry to put you on the spot, Juliet, but is that link still active for overall volunteers for the ongoing S&G projects?
I don't believe that's still up. Nikki, do you know
The
anything?
standards and guidelines writing committees, that's still open as a volunteer opportunity until the 10th of February. So if I can find the link, I'll drop it in the chat, but that is still open. The big call for volunteers that we had in December, that did close, but there are many opportunities throughout the year, including the standards and guidelines writing committees that is open right now. So let me see if I can find that link and I'll drop it in.
That's perfect. I knew it was going to close sometime in early January, so thankfully we have another 5 days. And I got to tell you, it's actually a very nice and easy portal to use. So you're sent the link. I reviewed it because I am going to be chair of an ongoing consensus statement, and it really allows you to select first, second, and third choices to be on consideration for the writing committees for projects that really interest you. So it's a really great way to do it. And looks like Nikki's looking that up. And so I think really that's going to be the two-pronged strategy. Think about how we can engage in the society in terms of the meeting and then also these ongoing writing opportunities. And, it's interesting because my experience with other societies is that sometimes it takes a long time to break into these volunteer roles. You're not really sure where to go. Or even sometimes when you're starting out, maybe you think you're not welcome, even if you totally are. The great thing about ISHLT is that it's very straightforward in terms of finding out where the work is, and it's very welcoming, and there's a lot of opportunities, and it's really enriching and engaging. And it looks like here, Nikki went ahead and put in the main site for the S&G opportunities. I would encourage anyone, and I see there was a text from Denisa, talked about looking to get more involved. And Denisa, if I've covered everything, let me know, or any other questions, let me know. But I would definitely click on this link. If you're watching on YouTube, you have the next 5 days. Look at the main site for the standard and guidelines opportunities about how to get involved. And you can look for the call for ISHLT document contributors, the deadline of which is February 10th. So, Richa, did that cover it for you?
Yeah, that's fantastic. Thank you so much, Archie.
Yeah, totally. And as I said, all are welcome. You know, anyone can apply, anyone can seek out these opportunities. And there's been opportunities I've gone for which maybe haven't necessarily worked out. Because you apply for an S&G writing committee, for instance, does not mean that you're necessarily going to be um, selected to be on that. But I would say keep applying, keep trying. And as I said before, plenty of opportunities and all are welcome. And we're also joined by some of the leadership of ICHLT. Juliet, who you've seen here from the beginning, takes good care of us in so many different ways, as does Greg and Nikki. Nikki is our new director of membership engagement. I've worked very closely with her as a member of the membership committee. And Greg is the CEO of ICHLT. Greg, do you want to say any words to our professional community town hall?
Well, I will echo first, thank you for your fantastic leadership. Um, and I want to echo what you said about the anesthesiology and critical care professional community punching above its weight. For one of the niche communities in ISHLT, I believe this group had the second most YouTube views for a webinar, and you've consistently grown more as a percentage year over year, more than the other professional communities. And one of the things that one of the things that makes ISHLT truly special is the interdisciplinary nature, and what is essential to that is the specialized communities like anesthesiology and critical care, like pathology and infectious disease, the folks who are not the surgeons, the cardiologists, and the pulmonologists. Without this group, ISHLT would not have that multidisciplinary character that is what really makes it special, and what makes the experience of participants at the meeting and participants in the standards and guidelines documents so unique is that uh, um, the participation of all of the members of the team. So I really appreciate that. Excuse me, I really appreciate that. And this really is a group that is central to everything that ISHLT does, and to what makes ISHLT a special community.
Thanks, Greg. And one thing I also wanted to add in as well is that ICHLT, you'll see people who are the absolute leaders in transplant from around the world. And everyone is very accessible. There's a lot of humility amongst everyone who's a member. To be honest with you, you can approach people, you can talk to them, you can bounce your ideas off. And it also makes a really excellent forum for mentorship and sponsorship. And that's one of those things that I think all of us are seeking, no matter where we're at in our career. In my opinion, it's something that all of us need for our personal and professional growth. And so there's opportunities to not only receive that, but also to pass it along. So once again, I just wanted to really emphasize that the structure of the society and that the support and the mission of all the ISHLT staff are integrated to really make this a society that's really worth it for you to invest your time in. You put in time into the society, you show up, you engage with people. I think you're going to get a lot out of it. And obviously, I'm speaking from my own personal experience, but I know other members of the PC leadership community, as well as other colleagues that have been in our professional community and continue to do so, would echo that as well. And I'd be happy to answer any other questions that come up or anything. Um, if no one has any other questions though, or any other comments, um, this is going to be put on YouTube, but I think my email address is pretty public due to PubMed. So martin.archer@mayo.edu. Feel free to reach out to me via email at any time. I see, looks like we have a hand up here.
Yeah, nice to meet you. My name is Maurizio. I'm an intensivist and a cardiac anesthesiologist. I work in Boston, and it's my first time, my first contact actually with the society. I'm potentially interested in participating in the society. I have a question regarding possibility about making research in the group, if there is any regular pathway to do collaborations or something like that.
That's a great question. And I think on a foundational level, one of the best aspects is that the community that I talked about, the relationships you form, not only will ideas be germinated in that environment, but also that collaboration is almost built into ISHLT proper. Now, looking more broadly in terms of the professional community, we don't have any formal clinical trials networks or any formal research pathways, as it were. But the ISHLT does have quite a few grants that you can apply for within specific areas. I don't have that list. I know it's pretty exhaustive. And just wondering, by the way, where are you at in Boston? I actually spent some time up at MGH many years ago.
Yeah, I'm working at Beth Israel, Deaconess Medical Center. Is well, is one of the Harvard hospitals. But originally I'm from Italy, as you can guess from my accent, and I moved here to Boston like just 5 years ago.
Oh, that's wonderful. Well, I'm glad that you came today. So I think that probably is the best way to sort of address that question in terms of the research. Greg, did you have anything to add, or did I kind of cover it from foundation up to the potential grants?
Yeah, I will add that we do see a lot of people posting surveys that are part of research or looking at identifying other centers to collaborate on ISHLT Connect. And as a member, you're able to post you can post a message to the open forum, which is seen by all members, or you can post it to the specific community that's relevant to what you're looking for, whether it's this community or another community. And that's been very successful in terms of people generating survey results and identifying potential collaborators across at other centers.
One other thing too, Maurizio, that I'll highlight is that, I know all of us go to a lot of different societies and meetings, and all of them have a lot of wonderful content. One of the great things that I've always appreciated about ISHLT is that within our four main interdisciplinary networks, as I mentioned before, MCS, PVD, heart, lung transplant, and of course, not just transplant, but really end-stage disease.
Mhm.
The level of science that's present at the annual meeting is incredible. Having been able to have that opportunity to serve on the program planning committee and to look at the quality of the abstracts, the quality of the late breaking abstracts, just the nature of the presentations, it's really, really good. And I just think not only all the other things that we talked about, but just the actual scientific quality of the meeting is really incredible. And then to be able to easily go up afterwards and speak to people and begin those conversations, begin those relationships that'll take time and that grow and that lead to opportunities is something that is really cool about ISHLT.
Thank you.
Yeah, of course. I will give out my email address again, just in case no one heard it. And I will also have my finger on the spam button as YouTube, takes in my email address, but martin.archer@mayo.edu. Please feel free to reach out, to email me any questions if you want to talk about coordinating ahead of Toronto. It's going to be a really, really great time, a great time of collaboration, a great time of learning, and a great time of building these academic relationships that will really be fulfilling for each one of us individually, collectively as a group, and then ultimately and most importantly, for our patients who are suffering from end-stage heart and lung disease. So thank you everyone for coming today, and I look forward to seeing you in Toronto. Take care.